Do you frequently feel like your body just can't fight off even small infections? Imagine you cut your finger while chopping onions, and instead of healing in a few days, it turns red, swollen, and doesn't get better for weeks. Or every time you catch a cold, it turns into a serious lung infection. That's what life can be like for someone with chronic granulomatous disease, CGD. CGD is a rare condition where the immune system struggles to kill certain bacteria and fungi. This happens because the white blood cells, your body's security guards, can't produce a key weapon, a substance called reactive oxygen that destroys germs. Without it, infections keep coming back, and over time, the body builds hard lumps called granulomas, kind of like scar tissue around the trapped bugs. So, are you starting to see how even tiny infections might become big problems? So, why does this happen? It all comes down to faulty instructions in your genes. Think of your body like a smartphone, and your genes are the apps that run everything. In CGD, one of those apps, say, the microbe destroyer app, is broken. The most common app or gene affected is on the X chromosome, which is why it mostly shows up in boys. But other genes anywhere in the body's DNA can also be damaged. These genes help build a team of proteins called the NADPH oxidase complex. When this team doesn't work, white blood cells called neutrophils can still eat bacteria but can't kill them, like a security guard who captures a thief but can't lock the jail cell. These bacteria sit alive inside the cell, causing ongoing trouble. Did you know some babies inherit this from parents without anyone knowing? It's like getting a toy with missing parts before you even open the box. What would make you or a child suspect CGD? Let's play a little game. Check if any of these sound familiar. Have you ever had a skin infection that just won't go away, even after antibiotics? Or maybe a gum disease that keeps coming back? What about swollen lymph nodes, like a lump in your neck that remains for months? In kids, you might see poor growth, like a 7-year-old who weighs as much as a 4-year-old. Parents might say, "My child gets pneumonia almost every winter." Or maybe they keep getting liver or bone infections from common soil molds. Even mild issues like diaper rashes or tummy bugs can turn serious. The body keeps trying to trap the germs, so granulomas form, sometimes blocking the bowel or urinary tract. If you're thinking, "Wait, that happened to me," it might be worth asking a doctor about deeper testing. How do doctors figure this out? First, they might say, this infection pattern is unusual. Then they run a special blood test called the DHR, dihydroergotamine test. Imagine coloring your white blood cells with a glow-in-the-dark dye. In a healthy person, when exposed to bacteria, the cells light up, like turning on a flashlight. In CGD, they stay dark. No light, no germ-killing power. Another test, the NBT, works similarly. Once confirmed, treatment starts immediately. The goal: prevent infections. Patients take daily antibiotics, like trimethoprim sulfa, and antifungals, like itraconazole, kind of like always wearing a raincoat in a rainy city. If infections happen, stronger meds or surgery may be needed. For severe cases, a stem cell transplant can reboot the immune system, like replacing a broken engine. Have you ever rebuilt something from scratch to make it better? That's what this can do for kids with CGD. Can we stop CGD before it starts? Well, you can't change genes on your own, but knowledge is power. If a family already has a child with CGD, genetic counseling is like using a family roadmap. Doctors can test unborn babies via amniocentesis or embryos in IVF for the gene fault. Think of it as checking the software before downloading. Also, families learn to avoid things like lawn mulch or compost, places full of fungus. Simple habits help: hand washing, well-cooked food, avoiding crowds when sick. No, you can't live in a bubble, but you can be smart. Wouldn't you want your kids to grow strong with fewer hospital trips? Now here's the exciting part: science is racing ahead. Gene therapy is being tested, where doctors take a patient's own stem cells, Fix the broken gene in the lab and put them back. Early trials show some kids start producing functional immune cells. It's like editing a typo in a book, so the story works again. Another advance is targeted drug delivery, using nanoparticles that help white blood cells fight better. Researchers are also studying how to reduce inflammation without weakening defenses. Some patients may one day stop daily meds thanks to these breakthroughs. Isn't it amazing that fixing one tiny part can change a whole life? The future is cautious but hopeful.